DNR and end-of-life planning. DNR, do not resuscitate orders, and the critical nature of end-of-life planning, how they are perceived by the public. As a grandchild of a patient who really took the time to evaluate her end-of-life decisions, I am aware of how important these decisions can be. Only you know yourself and what you want out of life. When you are of sound mind and sound body and can make better choices in advance of something catastrophic happening, you can better prepare your loved ones for the events of your passing. What is a DNR order? The American Medical Association, or AMA, states in its Code of Ethics that efforts should be made to resuscitate patients who suffer cardiac or respiratory arrest, except when circumstances indicate that the cardiopulmonary resuscitation, CPR, would be inappropriate or not in accord with the desires or best interest of the patient. Resuscitative efforts should be considered inappropriate by the attending physician only if they cannot be expected to either restore cardiac or respiratory function to the patient or to meet established ethical criteria. DNR orders only preclude resuscitative efforts in the event of cardiopulmonary arrest and should not influence other therapeutic interventions that may be appropriate for the patient. Some would say that a DNR order is no better than euthanasia, which is by definition doctor-assisted suicide, whereas a DNR order by the patient's choice is allowing nature to take its own course. When you gain self-awareness, the world becomes yours. The path you walk is made by your choices. When the path is winding down, you also have the right, if given, to take it, even if to avoid living in pain. There are pros and cons with every decision in life, and depending what the outcomes are gives the situation a different level of emotion. Patients that choose to talk to their families while making end-of-life choices have a better death acceptance, especially those who are terminally ill. David Muller, MD, chair of medical education at Mount Sinai, wrote in favor of DNRs, stating, "Preparing for death has its own ritual. It requires many family meetings, innumerable phone calls, lots of reassurance, and a great deal of reinforcement." In other words, patients don't take the DNR order lightly. It's a very trying choice even to fathom without the support of loved ones. Even if they are sick and they know they're going to die, more than not, they are worried about whom they will leave behind instead of what they're going through. In those situations, only the immense pain they are going through brings them back to their own predicament. Hospice Patients Alliance President Ron Panzer wrote in an article, Dancing with Death, against DNR, saying, "Some people should be allowed to die when it truly is the end." But that logic can be and is abused. People are labeled as DNR inappropriately so that even minimal, ordinary treatments like providing food and water are denied to them, with the intent they die sooner, much sooner. His belief is that DNR orders are used to avoid giving proper medical care by doctors. Agreeing to disagree, there may be some doctors that use DNRs as an easy out. But that said, most if not all doctors are ethics bound, to say the least, by the Hippocratic Oath. Referring back to the AMA Code of Ethics entry, resuscitative efforts should be considered inappropriate by the attending physician only if they cannot be established either to restore cardiac or respiratory function to the patient or meet the established ethical criteria. DNR orders only preclude resuscitative efforts in the event of cardiopulmonary arrest and should not influence other therapeutic interventions that may be appropriate for the patient. In other words, a DNR order would not prevent giving someone food or water to live. The world isn't created equal. That said, people in charge of administering medical care need to be given the benefit of the doubt. As potential patients, we have a due diligence to do our research when finding a family doctor or specialist, if the case may be. When I think of death and its measures of a person, I think of a poem by Linda Ellis entitled "The Dash." It begins with, "I read of a man who stood to speak at the funeral of a friend. He referred to the dates on the tombstone from beginning to the end. He noted the first came the date of birth, and he spoke the following date with tears, but he said what mattered most of all was the dash between those years, for the dash represents all the time they spend alive on earth, and now only those who love them know what that little line is worth." When talking about DNRs and end-of-life planning, depending on your situation, think about the time they had on earth, and though it hurts, think back to the poem and what the time is worth. In the end, only you know what you want out of life, and your loved ones are smart enough to make their own decisions. But the best thing you can do is to have open communication. That is the main thing. It'll make the transition between life and death that much easier and a better outcome for everybody. I am in support of DNRs and all they're worth because it helps ease the burden on your family when you pass.